Honourable for Calgary-Lougheed.
Thank you, Mr. Speaker. The Opioid Emergency Response Commission is an important weapon in the war against opioids in Alberta, and I have no doubt that the excellent panel members will work tirelessly in tackling the ongoing fentanyl crisis. However, Albertans may never be able to appreciate the contributions of this committee because the recommendations are to go directly to the Minister and Cabinet, where they can select suggestions with no public accountability. So to the Minister, for the sake of transparency and to save more lives faster, will you direct the Commission to report on a quarterly basis to the Standing Committee on Families and Communities?
The Deputy Premier.
Thank you very much, Mr. Speaker. It's my pleasure to address a question raised with regard to the devastating opioid crisis, which is impacting Albertans' families, communities, and of course those who have been victims themselves. And that's why we must move rapidly, Mr. Speaker, and why we announced the Opioid Emergency Response Commission, which includes, again, harm reduction program experts, parent advocates, law enforcement, and others. Mr. Speaker, we're keen to implement their recommendations. We're very proud of the stakeholders that have been coming together to do this work, and we'll be proud to update the House in a timely fashion on the very important outcomes.
First supplemental.
Given that the Kainai, out of grave necessity, became a leader in Canada in addressing the fentanyl crisis at a local level, and given that this model included distributing naloxone, proactive on-reserve enforcement to prevent trafficking, and establishing a successful opioid replacement to treat addiction, and given that the fentanyl crisis is a life and death issue in a number of First Nations communities across Alberta, to the Minister of Indigenous Relations, what are you doing to monitor the crisis on other reserves, and what specific actions have you taken to implement the Kainai's successful framework on other reserves clear across Alberta?
Deputy Premier.
Thank you very much, Mr. Speaker, and to the member for the question. We're proud to be able to move forward in partnership with a number of Indigenous leaders, including Dr. Esther Tailfeathers, who's actually part of this specific Opioid Crisis Response Commission, Mr. Speaker. It's important that we work with leaders throughout our communities and acknowledge the very important role and they play in standing up for their communities and their members as well, Mr. Speaker. On Monday, we opened a clinic in Grand Prairie, which of course has many First Nations in close proximity, and it has a capacity to treat up to 200 people, Mr. Speaker. That was last Monday. We're very proud of that work, Mr. Speaker.
Given that in their efforts to address the fentanyl crisis within their community, the Kainai have also taken a very proactive and preventative approach to addiction. And given that this includes recognizing the underlying issues which lead to addiction, including poverty, poor educational opportunities, unemployment, and a lack of housing supports, amongst others, to the Minister of Health this time, what specific initiatives have you undertaken with the Minister of Indigenous Relations to expand this approach to other reserves, and what are you doing to implement this approach in all affected communities right across Alberta?
The Honourable Deputy Premier.
Thank you very much. As the Deputy Premier and as the Minister responsible for this file, it's my pleasure to address this answer, Mr. Speaker. On Monday, again, we addressed a number of those communities in Grand Prairie. We're also opening additional space in Wetaskiwin, Rocky Mountain House, Stettler, Ponoka, and surrounding areas. And I am very proud of the work we've done with Treaty 8, for example. We have working groups that sit down face-to-face and talk about the challenges they're facing with regard to a number of different ministries, Mr. Speaker. I think this is bringing about great outcomes for our community, and it will take time. We have a significant deficit that we're making up for that was created over many years, Mr. Speaker, but we certainly have the right people at the table to make significant improvements as we move forward, including the Minister of Indigenous Relations.